Is your vitamin B12 level low? Everything you need to know about vitamin B12. Coming up. What is vitamin B12? Vitamin B12 is a water-soluble vitamin. It is also called cobalamin. Why is vitamin B12 important? Vitamin B12 is an essential nutrient. It helps make your body's blood cells, such as your red blood cells. It also helps keep your nerve cells healthy. Vitamin B12 is important for helping to make your DNA in all your cells. This vitamin can't be made in your body. Your source of vitamin B12 is from food or supplements. What are dietary sources of vitamin B12? Vitamin B12 is present in a variety of animal products. These can include eggs, dairy products, fish, meat, and poultry. They can also be found in fortified breakfast cereals as well as in fortified nutritional yeast. If you're a strict vegetarian or vegan, you might not have adequate amount of vitamin B12 in your diet and should be supplemented. According to the NIH, the recommended daily intake for adults above the age of 18 is 2.4 micrograms per day. B12 supplementation. Vitamin B12 supplements are found in various formulations. They're easy to identify as they're labeled as vitamin B12. Other names you could encounter are methylcobalamin, cyanocobalamin, or hydroxycobalamin. Here in the US, as well as in several other countries, you can get it over the counter. Usually, it is in a tablet form. It can be also given as a liquid or sublingually. I would not recommend the form which is nasal, as it can cause a runny nose and is more expensive. Dosing and administration of vitamin B12. Here you can see the various or different forms of vitamin B12. Chewable tablets, extended release tablets, sublingual tablets, sublingual spray, oral liquid, nose spray, oral disintegrating tablet, injection. When do you need supplementation? Your healthcare provider at your office visit will need a thorough medical history, perform a physical examination, and check your complete blood count and blood smear. If they suspect B12 deficiency, they can check your B12 level. Please note, in certain malabsorption conditions, your healthcare provider should also check for folate deficiency. At what values do I need supplementation? You're deficient if your value is less than 200. You're borderline if your value is between 200 and 300. You're abnormal if your value is over 300. More about what doses are being supplemented for different disease entities later in this video. What are risk factors for vitamin B12 deficiency? Not taking in enough vitamin B12 in your diet. People who are at risk are older adults, vegetarians and vegans, and if you abuse alcohol. Prolonged use of medications such as metformin, stomach protective medications called proton pump inhibitors, or H2 blockers. Examples for these medications would be omeprazole or ranitidine. Decreased absorption in your small intestine because of diseases such as Crohn's disease or tapeworm infestation, or after an operation in your small intestine where part of your intestine has been removed. Genetic causes, for example, such as Irmsland-Grace-Beck syndrome. Lack of a protein called intrinsic factor. This is seen in different disease entities. Examples would be atrophic gastritis or pernicious anemia. It is also seen after bariatric surgery or operations where your stomach is removed. B12 deficiency symptoms. I did a whole video on signs and symptoms to look out for. And if you're interested, click on this link. Here are the main ones. Fatigue, numbness and tingling of your extremities, trouble walking, mouth pain, pale skin and yellow skin, blurred vision, fast heart rate, shortness of breath, memory problems, mood changes. A lot of these symptoms are associated with anemia. The type of anemia typical for B12 deficiency is macrocytic or megaloblastic anemia. B12 deficiency leads to high levels of homocysteine, which can cause brain and central nervous system neurotoxicity. This would result in signals being sent along your nerve cells being disrupted. Treatment and monitoring. Like I promised, the dosing for different disease entities. Mild B12 supplementation is as follows. Oral, 500 to 1000 micrograms daily for 1 to 2 weeks, then in a maintenance of 1000 micrograms daily. For severe B12 deficiency, you can take B12 orally, 1000 to 2000 micrograms daily for life. There are situations such as after stomach surgery or small intestine resection, inflammatory bowel disease such as Crohn's disease. For pernicious anemia, intramuscular supplementation is preferred 1000 micrograms daily for a week, then weekly for 4 to 8 weeks, then monthly. Once you've been supplemented appropriately, your anemia should start improving within a week or two and normalize within 4 to 8 weeks. Neuropsychiatric symptoms may take 3 months to improve and sometimes may take up to a year. However, some of the neurological symptoms described may be irreversible if they've been present for a long time. It is good practice to repeat a complete blood count and check for the deficient vitamin B12 level in about 4 weeks after starting supplementation. Okay, I'm done. I realized during this video that my audio was not working. This is the second time I'm doing this. So I did it, didn't work, doing it again. Hope it worked. Fingers crossed.